Good morning, everybody. This is Kate Warnock. I'm the GuideWell social media manager, coming to you live from day 2 of MediFuture. I'm delighted to have with us today Dr. Rushika Fernandopulle in the GuideWell Insights Lounge. Welcome to the lounge.
Thank you. It's great to be here.
We're so glad to have you. So, given that you have a keynote address, we're going to jump right into our questions for you. So, Doctor, you are still training medical students, given all of your other responsibilities. But can you tell us what is it that you emphasize with your students today that's going to help them meet the needs of tomorrow's patients?
So the one thing I tell people is that the job of being a doctor in the future is actually going to be very different than, unfortunately, what they're being trained to do today. Right now, what you're being trained to do is see one patient at a time and do the best job you can with each one and diagnose and treat. And that's still important. Unfortunately, I think the doctor of the future needs to be what I call a system architect. The job that needs to be done is not seeing one patient at a time, but that we have populations of people and they are our problem. And our job is to improve their health and keep them out of trouble. And to do that, you need to not just diagnose and treat, but run a system that actually figures out who are the people I should focus on, how do I outreach to them as opposed to waiting for them to come into the office, how do I use technology, how do I work with psychology, how do I interact with the payment system. So there's a whole set of skills that I think I encourage folks that they need to get exposed to if they want to practice in the future.
So it sounds like you're preparing them for a new model of care delivery, much like you are the CEO and founder of Iora Health. Excuse me. What is it in today's environment, if that's the new model of care delivery, team-based care, where your physician is a system architect, how is it that traditional hospitals and other medical practices that are, that more, that individual doctors visit, how is it that they can maybe migrate or evolve into a team-based setting, or maybe even just take the best practices of what Iora Health offers?
Yeah, so I think the future has got to be not just about the doctor. Of course, we're an important part, but there are a whole host of other folks, people we call health coaches, who are folks from the community who can interact with patients, nurses, social workers, therapists, who need to be a part of it. I think right now we keep these folks in silos, and I think what you need to do in a health system is get people out of those silos. Right? And I think it's one thing to call people a team, it's another thing to actually be serious about it. So a few things that we do, I think, that are replicable generally. So one is we start each day off with a huddle, where the whole team gets together and talks about the patients and what they're going to do. Anyone can do that, right? You need to take it seriously, you need to do it well, but that sets the whole team up for what are we going to do today, what are things people will do. Number two is I think teams are really about sort of the way not to do a team is this traditional, I'm the doctor, I'm the captain of the ship, everyone listens to me. You need to do things to make everyone on the team feel like they're part of it. So a really simple thing we do in our huddles is the doctor doesn't run the huddle. The first thing we say every day is we all run this team, we all run the huddle, and we take turns running the huddle. So the front desk person runs the huddle one day, the health coach takes it, and the doctor does get a turn because you're part of the team, but it's not about the doctor running the ship. Right. So I think there are a lot of little things that way that signify to people, and we do other things. So the doctor doesn't get a private parking place, parks where everyone else does, right? And again, this is not for everyone. This is a little countercultural, but I think if you take teams seriously, you need to sort of get out of the hierarchical mode that we've gotten into.
Well, as I was researching Iora Health, Doctor, I know that team-based care is obviously it's the foundation of your model. You take it very seriously when you do put together your team, and you are very careful with whom you select locally. So can you tell us a little bit more about your hiring practices, and how do you know the right fit for the team that's going to give the best kind of care?
Yeah, I think the thing that we do poorly in healthcare is focus on culture. We focus a lot on skills and the like, but we found, particularly where our health coaches, and including our doctors, that it's all about getting people with the right cultural fit. And really the skill that we need most of all in healthcare, I think, is empathy, being able to connect with other human beings. This is at root about behavior change, and you need to connect with human beings to be able to do that.
Absolutely.
So it really is hire for attitude, train for skill, because I can't teach that. I can teach everything else. So the question is, how do you find it? So I can tell you how you don't find it is resume. So resumes are a lousy way to tell about interpersonal fit. It selects for people who are good at writing resumes, right, or who happen to have had a bunch of experiences. So we found this. So there are a number of cultural fit tools that people in other industries have used, Southwest Airlines, Ritz-Carlton, and we borrow some of those. We found a really good tool is ask people to make a 1-minute video of you teaching us anything. And it's a really good way of very quickly, much quicker than doing a resume, just getting a quick sense of who these people are and how well they can connect.
Right.
And then the thing that works the best is actually speed dating. And we learned this from one of our sponsors, Zappos, where we get a lot of people in, 400 people in, and they have 5 or 6 of us who we think have good empathy skills. And you literally talk to us, you ring the bell, and you move to the next person. And in 5 minutes, let's see if you can connect. And if you can connect with 6 different sorts of people, then you're someone we want to talk to further.
I would say that's probably a pretty revolutionary way to approach, hiring for medical practice, but obviously it's yielded wonderful results. Certainly you're hiring for empathy, you're training for skills, but I wonder, what is your opinion on someone like a physician extender or a nurse being able to really practice at the top of their license? Why is that important in the team care approach?
Yeah, I think it's silly. If you have the question, what percentage of the things do I do as a physician during a typical practice, in a typical practice, that doesn't require my MD? The answer is probably 80% of it. And that's just silly, right? It means that I'm not using my skills and it's inefficient. And there's a lot of stuff that other people can do. So really the idea is, we have to say, what's the job that needs to be done and who's the best person to do it? And it doesn't necessarily mean the doctor, right? So I think our teams have lots of folks, physicians, NPs, nurses, medical assistants, and none of the aboves. And let's just be fluid about who does what, who has relationship with the patients, and let's just make sure we communicate tightly in the beginning of the day at the huddle and throughout the day so we're all on the same page. I think this is not a threat. There are plenty of patients out there. There's a huge shortage of primary care doctors, right?
Right.
I don't see doctors starving on the streets. So I think we need to get over that. We spend too much time in healthcare designing the system around our needs as opposed to around our patients' needs. So we should start with what's the best way to deliver these things to our patients and then figure out which of us is the best one to do it. And that's the way to start.
So I think you've touched on many recurring themes that we heard from some of our interviews yesterday. Team-based care really does put the patient at the center of the care delivery system, yet it also results in higher satisfaction, not just for the patient, but for the people who are taking care of them. So the doctors get to practice the medicine that they went to school to teach or to train. So I'm so grateful for your time today with us, Dr. Fernandopulle. I know that you're about to go give your keynote. We're excited to have you. We actually have another video of Dr. Fernandopulle being interviewed with Tom Main from Oliver Wyman. So let's go ahead and roll that. In the meantime, we'll be back with you live shortly. This is Kate Warnock, coming to you again soon.